Then good morning, everyone, and welcome to this special occasion, the launch of the second edition of the World Oral Health Atlas called The Challenge of Oral Disease. My name is Daniel Zimmerman. I'm working as group editor for Dental Tribune International. We have a long-standing relationship with the FDI as the publisher of the World Dental Daily newspaper, also available here at the Congress in Thailand. And our company is also the official media partner for the FDI's World Oral Health Day campaign. And I was asked here to moderate this special session about a special publication, so to say, which was launched in 2009 at the FDI Congress in Singapore as a comprehensive source book providing information about difficulties and issues in oral health. And we are very glad to have the two authors of this publication here today to answer some questions about it. On my right is Professor David Williams. He is Professor of Global Oral Health at Barts in the London School of Medicine and Dentistry in London. He's been, he's held several positions at the University of Southampton prior to that, and you've been also president of the International Association of Dental Research. And we also have here Dr. Habib Bensian, who is an adjunct professor at the Department of Epidemiology and Health Promotion of New York's University College of Dentistry. And he lives in Berlin and has his own consulting firm in the UK. Which deals with international health, I suppose. And he's been involved in both versions of the Oral Health Atlas. And this brings me to my first question. Maybe you can talk a little bit about how the idea came to be and the concept behind this publication, and how do you became involved?
Thank you, Daniel. First, to clarify, we are not the authors of the Atlas. We are editors-in-chief.
Editors, yeah.
We had a group of 30 people, academic, National Dental Association experts involved in contributing content to the Atlas. Our job as editors-in-chief was to bring it into a coherent style, to come up with a storyline, to check the evidence, supplement graphics, the job that an editor is supposed to do. Back to your question. The Atlas, the first edition of the Atlas, launched in 2009, as you said, was actually the first time that the extent of neglect of oral diseases was mapped comprehensively across different data sources, different domains of neglect, different dimensions of neglect. And the Atlas followed a concept that of other health atlases. The most prominent one was the Tobacco Atlas, which was launched mid-2000s and which had a great impact on the international public health community. And that is also why one of the key authors of the Tobacco Atlas, Professor Judith McKay from Hong Kong, was a co-author at that time of the Atlas. And by the way, we have another of the previous co-authors in the room, Robbie Beaglehole. So the Atlas was put together or conceived by FDI as a resource book for oral health on a global level to map the status of neglect. We had some intentions at the time with the book. As it turns out, over time, we see how the book is used. We saw how different audiences were using the information and the book itself, and that's helped us to shape the second edition now in a slightly different way.
That brings me to my second question, maybe directed to Professor Williams. Can you tell us a little bit about why this publication, I mean, it's been 6 years, but why this publication needed an update, and what exactly changed compared to the first version?
Well, let me deal first of all with what's changed. I think, as Habib's just said, the first edition mapped the disease and brought that to attention. Since then, there have been better analyses, evaluations, if you will, of the burden of disease. The most important publication, I guess, was in the Lancet at the end of 2010, which was the Global Burden of Disease study. And what was really crucial about that was that within that study, that showed that the most prevalent of all the nearly 200 chronic diseases that were mapped, the most prevalent of those was untreated dental caries or tooth decay. Untreated tooth decay in the deciduous or milk dentition, the primary dentition, was within the top 10. Periodontal disease was in the top 10. Edentulousness was also one of the more prevalent conditions. So I think that brought to our realization that the world needs to appreciate the general challenge that oral disease presents and the need for global action, hence the title of the new edition. So in essence, what the new edition has done is really two things. One is to update the data from the first edition, but secondly, to be quite explicit in the sense that this is now a call to action. It's an advocacy tool. And we were aware that the first edition was being used, yes, as an important source book by all sorts of people. It was highly valued by national dental associations, by dental educators, by dental students. The new edition is aimed now not just at those constituencies, but also very, very directly at policymakers, opinion formers, and to be used by national dental associations and others as a clear advocacy tool. And as we'll go on in a minute and explore, no doubt, it's written in a style that allows it to be used very, very directly for that purpose. So it has a much more instrumental function than the first edition perhaps had.
Yeah. As you said, the style is very comprehensive and very focused. What were the challenges actually to put it together, to make it more approachable for people that are not actually involved in the industry? Maybe you can.
Well, sure. If one looks at the way it's laid out now, there is a somewhat consistent style. There's a narrative in the first place that says, okay, these are the main oral diseases, so tooth decay, gum disease, oral infections, particularly HIV, oral cancer, developmental abnormalities, and so forth. So we give a thorough account of the current state of knowledge of those. We've used graphics to a high degree, so we've used maps that show distribution, and in particular those maps show the variation in severity of disease and prevalence of disease region to region. We then look at the risk factors that are associated with those diseases, and acknowledging the fact that oral disease is a non-communicable disease like heart disease, chronic obstructive pulmonary disease, many cancers and so on. We now look at risk factors and the social determinants of those diseases. So that is to say, what is the causation that lies behind them? And understanding that causation, what kinds of strategy do we then need to develop to address those diseases? So it's that narrative arc. And I guess the real challenge that Habib and I had was to take the subject matter experts' contributions and to weave them into that narrative.
Yeah.
Yes, and we have added new dimensions as well to the style and overall concept of the atlas, like the patient testimonies. They add a totally new dimension and make the abstract facts more approachable and more people can relate in a more direct way to what it actually means, what the impact of a certain condition is. We read something, a statement from a mother or of a person, of a real life person. So that makes it easier to understand the dimensions of impact of the diseases. And in some areas we have also added new topics which were not part of the previous edition because of international developments. The Millennium Development Goals are now replaced by the Sustainable Development Goals. We have other emerging topics which needed to be covered and addressed. And I think the Atlas is one of the first publications to actually do this and bring oral health back into the context of international health in general and the mainstream topics which are important today.
Yeah. What are the most, when you look back to the first edition, what are the most important changes that you have noticed by putting together the second edition in terms of what issues actually in oral health are, or how actually are certain topics or issues are changing or have changed in the last 6 years?
Yeah, I think some of those things that I mentioned, like David mentioned the chronic non-communicable diseases already, this is a main drive internationally. The recognition that those chronic diseases will become the main burden of disease for human mankind in most countries. The transition from the communicable, transmissible diseases to the chronic diseases is a big change. The first atlas did not recognize that to the extent because the international knowledge and movement and momentum towards that was not there at the time. So that is a very new topic. We have added, as I mentioned, those dimensions of international goal setting, the sustainable development goals. The whole complex or the whole package of social determinants is also a new and emerging international topic. The recognition that health is not only determined by individual behavior, but much more by factors that are outside of the individual, the social determinants. There has been a WHO commission working extensively on that, producing a report which has really changed the way we look at causation of disease. We have an entire chapter dedicated to this topic, which really highlights interesting facts for the first time in such a comprehensive way and in an easy, understandable way.
Yeah, so in short, some of the topics that were simply touched on in the first edition are now much more systematically developed. And this is part of making the case to policymakers that oral health is not just a disease at the level of individual discomfort and suffering, but has a major economic burden at a global level. So that policymakers can't simply say, but this is an issue of individual risk and behaviors, isn't it?
Yeah.
I mean, it's much more than that. And I think we've gone to great lengths to help those who use the book in its advocacy role to make the case that oral disease matters. It matters at the level of the individual, but it also matters at the level of society in terms of educational attainment and in terms of economic productivity.
Yeah, there's a whole chapter in the book. You already mentioned it about inequality in oral healthcare access. Actually, I think 2/3 of the world's population do not have proper access to adequate oral healthcare. What have you actually found, and what solutions are offered to decision makers in the book?
I think the important point that we make is that oral diseases are socially determined. There's a gradient across society from richest to poorest, and the poorest, in every case, suffer worse health, have worse health outcomes, and have worse health expectations as a result. That's true of most of the non-communicable diseases, and policymakers now are well aware of that. And one of the important points that we make in the Atlas is that all diseases sit on that same social gradient. So your social position determines the risk that you have, and that's the major inequality within any given society. But you also see those inequalities country to country as well. And so the challenge for policymakers is to address not oral disease in isolation or at the level of the individual, but to address the fact that the causes of illness lie outside healthcare systems and lie within society itself, so that it's a responsibility on society as a whole to address these challenges. And just as it's a responsibility of society to address heart disease, stroke, cancers, and so on, the same is true of oral diseases. Now, the kind of good news is that because the risks are the same and many of the determinants are the same, the sorts of strategy that will improve health outcomes for those major non-communicable diseases are likely also to improve oral health. And that's at the heart of the FDI policy to get oral health in all policies. The Adelaide Statement talks about health in all policies. What we're now saying is, yes, oral health is no different, and we need oral health in all policies. So if there is a single advocacy message in the Atlas, that's it.
Yeah. You also mapped out some other challenges in oral health, which includes education, research, and global migration. As we are in Asia right now, migration is is a major trend here. People are constantly moving from country to country. Can you talk a little bit more about that, the extent of the problem, and what the Atlas is actually suggesting?
Yes, migration is a big issue, and it's a good thing. Migration is part of globalization, of liberalization, of movement. It has positives and it has negatives. The first edition of the Atlas looked for the first time only at migration of health professionals and of dentists. This time we have included also the migration aspect of patients, because medical tourism is an increasing trend, particularly here in Asia, with patients traveling to Thailand, to many other places, to get care in a more affordable or faster way than in their countries of origin. So the migration of health professionals is the one thing. The migration of patients is another increasing trend. For the health professional side, there's a lot of activity and a lot of policy thinking around how to steer and control or mitigate effects, negative effects of health professional migration. If a country invests a lot in the education and formation of a health professional and of a dentist, and then the dentist moves out of the country to practice elsewhere for various reasons. Of course, that's a loss to the country, the original country. On the other hand, the professional may be practicing in a place and enrich that healthcare system where he or she is then moving to, and sending remittances back to the home country, which is also of an economic benefit. So the FDI a few years ago followed a call by the WHO and developed a policy statement on ethical recruitment of health professionals, of oral health professionals, because some countries are actively recruiting and targeting dental professionals from low-income countries to practice in other places. With regard to tourism, to dental tourism, of course the main driver is cost. Dental care is a costly thing for patients in many places, and if care can be obtained at a similar quality in other places at a lower cost, maybe even combined with a nice resort family vacation, and you have the whole procedure done in 2 weeks, and you go home with your full set of prosthetics or implants, that's attractive. But of course challenges are related to problems that occur afterwards, to warranty issues, to follow up, to cost sharing if some additional care needs to be done at home, if there are complications. So it's a complicated thing. The challenge for both topics, the migration of professionals and the migration of patients, is that we know very little about it. There's very little data and very little systematic research being undertaken on both of those issues. So we rely a lot on anecdotal evidence, on small-scale surveys that give us a bit of insight, but that's a big area of future research.
Yeah, that brings me to an interesting question. I mean, there's a lot of information in this book, or that went into this book. How difficult was it to bring this all together, and who contributed to the second edition of this book?
Well, the first thing to say is that the list of authors involved, the list of subject matter experts, is carefully set out. And as Habib has already said, some 34 or so experts contributed material. That information wasn't just collected in a random way. There was a very careful template that was produced. So the way in which each of the sections is conceived is that we have a 35-word key message for each section. There's then around 250 words of text, so that's ultra-distilled text. And then a lot of emphasis and a lot of information within the graphics. The consequence of that, of course, is that every page is extraordinary information dense. And so the challenge is to make that dense information accessible. So I think we spent a long time working on that. The other thing that we've been absolutely meticulous about is checking every single fact that's there. The maps look great, I hope, but the work that goes into those is absolutely enormous in terms of making sure that the data are accurate, that sources are the most recent we can get. So I think we have pretty fair confidence in what's in that text now. The other important thing that we've drawn out in individual sections in some cases, but certainly in the chapters, is key policy recommendations, and those sit in boxes. So at the end of each major section, there are clearly explicit recommendations that are set out, so that if you're looking through it and your question is, well, what should I do about sugar consumption, for example, or what should I do in relation to encouraging patients or communities to smoke less or consume less alcohol, because these are major risk factors for oral disease, as for many others. Those recommendations are set out there. And these aren't just recommendations that we've invented. Those are recommendations based on a careful analysis and screening and study of other policies to make sure that our messages are consistent with those that come from other healthcare professionals.
Yeah.
I mean, the beauty of the Atlas concept is that it draws on information from various sources and puts them into one place. So as a reader, normally you would not go to a database of the World Food Organization to check for sugar consumption. But here you have it in a book side by side with data on caries, with data on the disease burden, with data on the economics, which is bringing this unique and new insights and cross-topic comparisons that can be made. The challenge is indeed that for many of the topics we have very little data or very poor data, and our contributors and we as editors, we are just the messengers of good or bad news. We do very little in terms of interpretation. When you look at the caries map, for example, and you go into the section that explains where the data comes from, there's a dedicated section at the end of the Atlas which shows where our information sources were and what the challenges with the data are. You clearly see that only for 15% of the countries of the world, you have data which are within the last 5 years. And 1 in 3 countries has no information at all on the carrier status. That in itself is a message which we try to highlight with the Atlas. And I think there's no other disease entity in the world with the same scale of magnitude and prevalence as David said. It's among the 10 most common diseases, all of the oral diseases, but we have so little data on it. And that is a key message that FDI has used a lot in the past to make a case for better data surveillance.
So one of the things that we hope that users of the Atlas will take away, particularly national dental associations, is to look at the map and see the extent to which the recent data exist for their country. And if the data is missing, then there's a really strong case there to say, well, perhaps we need to fix that.
Yeah. Are there any issues actually in the second edition that you wish you had the chance to touch upon? Additional issues or topics that you were not able to, touch upon in the Atlas, because we were talking about the first edition, and there were some issues or topics that you were not able to cover to full extent. Is it basically complete now, or is there still room for extending the scope?
I mean, there's always room for more, but we decided on a clear cutoff point, because you can always continue and go into more detail. So we had an editorial cutoff point where we said any study that comes out after that, we cannot include it anymore. But from the range of topics, I think we are quite confident that we have covered the most relevant issues. There's one major paper, I think, that came out just recently about the global economic burden of oral disease and of oral care, which looked into the cost of oral health care in the year 2010. And all the costs, the direct and the indirect cost, amount to close to $450 billion worldwide, based on a rather complex methodology. So that is a staggering figure, 450 billion in 1 year worldwide, safely assuming that it is still an underestimation of the real cost. So those facts would have been nice to include, but that's life.
That's true, and I think the point that's worth making is that Habib mentions this paper that's come out within the last 10 days. The lead author of that paper was also the author of the section on the economics of oral health in the Atlas. So I think we're not a million miles from the truth with what we have there. From a personal point of view, when I became involved in the Atlas, I was really keen on two things. One, that it was made widely accessible. I argued that this was a book that we shouldn't. I said to FDI, if you want this to be widely used, if you want this to be used for advocacy, then is there a way of making that available at no cost? And I have to say, one of the great, if you will, gifts of FDI to the wider community is the fact that the Atlas is being made available as a free PDF download by accessing the FDI website. And I think that's a tremendous outcome. The other thing that we're really very keen on as well is to make sure that the Atlas doesn't lose its currency. The problem with any book is that it's published on a given date, and it's as close to perfection as is achievable on this earth at that date. And as everybody will say, yeah, the moment it's published, of course, it's out of date. I counter that by saying a lot of the diseases we look at are not transient diseases, they're chronic diseases that are with us for all time, as things currently stand, and the changes aren't that rapid, so I would argue that it doesn't lose its currency that readily. But one of the things that I think we're still looking at is ways in which the Atlas can be made available in real time so that we can update it progressively. That's still a work in progress, but the hope is that we won't have to wait 5 years to the next edition or 6 years to the next edition and have a major rewrite, but we'll be able to evolve it with time by accessing continual data sources that come out. It's, if you like, a very immediate application of the principle of big data to an Atlas like this.
Yeah.
And FDI has taken first steps in that direction with the Data Hub, which is available and accessible through FDI's website, which collates the main data related to that we used as a source for the Atlas in downloadable tables and maps that can be generated and tailor-made for presentations and other uses, and is constantly updated. So this is a place where this data collection and constant updating that David mentioned has already started and will expand further in the future, hopefully.
And those from NDAs and educators and others who want to make use of the graphic material in the Atlas for their own purposes will be able to do so as well, because those will be available in downloadable form as well, so that they can be used and inserted into presentations.
Yeah. To end on a rather positive note, what impact do you actually would like to see the Atlas would have on oral health or on decision makers in the future? What would
I said just now that FDI has as its mission to lead the world to optimal oral health, and to achieve that by arguing for the inclusion of oral health in all policies. I think what I would like to see as the outcome is the realization of that goal, and that the Atlas contributes to that outcome.
Totally agree with David. This is the ultimate goal of the book. The book is a tool for increased and improved advocacy, to make a better case, because we know, or we assume, that the low priority that oral diseases have internationally is mainly for three reasons. One is that if I'm a decision maker, I'm facing tough choices, and I have to spend my money in places where it matters most. So, of course, I go with diseases where I know that they kill people, have a high mortality rate, and affect many. The knowledge about oral health is very low among those decision makers, and the true extent of the burden is unknown. One, because we don't have enough and solid data. So that's where things go in circle. We have little data that is reliable and up to date, so it receives less attention, which then goes into a downward spiral. Then the last point for low priority for many decision makers is that they think oral care is too expensive, is too costly for their healthcare system. True, oral diseases are expensive to treat if we go for the high-tech clinical setting that we in high-income countries are used to. But the atlas shows that there are very effective and downright cheap public health interventions that can be done in every country. And we make a very strong case that the individual clinical approach is one way of addressing oral diseases, but there is a big and maybe even more effective and more important part that can be done on the policy side, working on the determinants of health and on those upstream root causes that are at the basis of oral disease.
The vision of FDI's Vision 2020 is that oral health is a basic human right, and without oral health, one isn't truly healthy. Habib is quite right in terms of the costs of treatment. Treatment often is expensive, but prevention isn't. Prevention is cheap. And we are dealing with the diseases that essentially are preventable. And the single big message of this atlas is that we have to be much more effective at a population level of introducing policies for effective prevention. Dentists do a terrific job, often under very difficult circumstances, of treating the burden of disease that exists. But the challenge of prevention lies at the level of society and populations as a whole, and that's the message that has to be got across.
All right, then thank you very much for coming by and taking the time to talk to us. The atlas is available for download, as Dr. Benzian said, on the FDI website. You can go there and check it out. And yeah, are we going for a question round, or are there any questions from the audience? All right, then thank you very much again.
Thank you.